So I've been in AMP for about 13, 14 years now, and I was not in this role then. I was in a respiratory nurse practitioner role initially, and it was around you evolve as a nurse. You get to a point where you're an experienced nurse, and then there's two ways to go, I guess. You go down the management route, or you look around for what's there to advance your clinical skills. And advanced nursing practice was a bit of a new phenomena in Wales then, so I went and did my masters, did my clinical assessment skills, and then eventually did my prescribing, and just gradually built on the clinical skills that I had at that time. So a large part of acute oncology, because it's a new service, is that I do a big element of teaching within the role, and we do a lot of audit, so that fits into the research pillar. Leadership and management is a larger part of my role. As the service develops, because we're a new evolving service, then I envisage that the clinical pillar will increase. I have lots of junior nurses who say to me, "Oh, I want to do what you do, that's fantastic." But my advice to them is always get that grounding in nursing, because if you evolve too quickly into being an advanced nurse practitioner, you don't have that experience behind you, then you won't know how to deal with some of the difficulties, because you do get put on the spot every day really with difficult scenarios to deal with. Unless you've got that experience to fall back on, it can be quite challenging. So I would get a good grounding in lots of different specialities if you can, and then look to developing yourself educationally and clinically. So my current speciality is within acute oncology. So the way I view myself is I'm an advanced nurse practitioner, as an advanced generalist, but working within a speciality. So my current speciality is acute oncology, which deals with patients who are admitted acutely to the health board, who have a known cancer, so they may have a complication of their cancer disease, a complication of their cancer treatment, or a new cancer which is diagnosed as an acute admission. The new cancer diagnosis is a big part of our work, so we support the patient with this difficult time that they're having, with the bad news that they have, but we also help support the junior doctors who are often left with difficult conversations, to support the doctor and the patient and the relatives in that scenario, and then try and do some feedback for the junior doctors afterwards, after the difficult conversation, but also then act as the key worker for those patients going forward until they're diagnosed and referred on to a site-specific team where the cancer site-specific key worker can take over. In developing the service, my vision for the service is that we can try to help with the admission avoidance for the health boards, help by taking them out of the emergency stream into maybe an ambulatory setting or an assessment unit for cancer patients, and try and avoid them being admitted, keep them at home, where if they're admitted they decondition. We need to keep people well enough for cancer treatments, and about developing the team to be able to do these procedures so that patients don't need to be admitted for them, that we can do it in an outpatient setting. So it's an exciting time to work in acute oncology in Cardiff and Vale, because we see ourselves as an innovative, groundbreaking service to improve the lot of cancer patients that are presenting to the health board.